My name is Reginald Hebert. I'm a postdoctoral research associate at the Yale School of Public Health in New Haven, Connecticut. I originally earned a bachelor's degree in English literature from the University of Louisiana, but after some personal encounters with the healthcare system both before and after the passage of the Affordable Care Act, I developed an interest in the economics of health and healthcare. Consequently, I returned to school, originally attending Austin Community College, and then earning 2 additional bachelor's degrees in economics and mathematics from Texas State University. I ultimately completed a PhD in economics from the Andrew Young School of Policy Studies in Georgia State University in Atlanta. My interest in tobacco regulatory science stems from what I think a lot of people understand, which is a personal connection to individuals who've had difficulties with substance use. This can extend across a variety of substances, but ultimately it's a circumstance where people want to make good decisions. They may even have access to good information about the substances they're using, but they are ultimately going to make decisions that are harmful to their health. This is where research comes in. It can inform public policy and guide behavior to lead to better health outcomes for individuals. So I'll briefly discuss 2 projects that I've been involved with in terms of tobacco regulatory science. The first involves cigarette taxes and the household budget. Now, when a government raises cigarette taxes, that means that prices will also rise, so that smokers are faced with a choice. They can either stop smoking or reduce their consumption of cigarettes. They can switch to a lower cost alternative. They can try to earn more money to pay the offset, or more likely they can just go ahead and reallocate their budgets, taking money from one place and putting it towards cigarettes. So in this research, what we do is we perform a randomized online survey experiment in combination with looking at data on spending from the Consumer Expenditure Survey of the Bureau of Labor Statistics. And what we find is that generally speaking, there are some people who will cease smoking or reduce smoking, but for those who continue to smoke, those individuals are going to take money away from other parts of their budget that we may not think are desirable. In particular, for lower income individuals, we find that they are likely to transfer funds away from potentially human capital forming expenditures such as groceries, for example, which is not what we would like to see. The second project concerns the e-cigarette flavor restriction policies that have been passed in a number of states. So essentially, these are designed to reduce the sale of items that are thought to appeal to youth, and particularly minors, those being flavored e-cigarettes. Now, one of the difficulties is that in the presence of these policies, we may see that people would switch to cigarette smoking if their preferred product is no longer available. In this case, however, we're not looking at simple substitution, but rather trying to determine whether this might affect people differentially. So we know that people have different behaviors that can kind of be lined up with some demographic characteristics, for example, socioeconomic status. So in terms of education, we're looking at populations of people who have never attended college versus have attended any college. And what we find when we observe those populations is that people who have never attended college generally have much higher levels of smoking overall. They also have higher levels of ends use. So what we look at is whether or not these policies are differentially affecting those 2 groups. So for example, if they're 10 percentage points in use apart beforehand, does that gap grow or shrink if such policies are implemented? What we do is we perform some analysis and then simulate a counterfactual national policy to see what the effects might be. And regrettably, what we find is that the gap does seem to grow in terms of substitution. We do see that people will turn to smoking, but they do so in larger numbers for the lower education group than they do for the higher education group, meaning that the gap actually grows by upwards of 3 to 5 percentage points, which is an unfortunate consequence of a policy that is intended to help people. So in both of the projects that I've discussed here, we find that there are negative consequences for some well-intentioned public policies. That being said, these negative consequences don't fall on the population uniformly. They are going to fall on individuals who are already disadvantaged in terms of socioeconomic status and access to health care. So research is critical in informing good policy and amending existing policy. I'm grateful to be part of the CAsToR team, and I'm looking forward to seeing where our research goes from here. Thank you very much for your time.